This is the Heard It Here podcast. I'm Brianna Brees with the Cross Country Genetics and Casey Wassam today. Could you guys go around the table and introduce yourselves?
I'm Toby Wilbur. I'm from Belleville, Kansas, and I went to college for 2 years at Colby, and then I transferred to K-State, and then upon graduation, I started working for Clay.
Hi, I'm Tony Shaw. I am from Alma, Kansas. I work for Cross Country, started in 20.
Awesome. My name's Clay Briner, graduate of Kansas State University, vet school and undergrad, and have been doing embryo transfer work since 2002, so a little while. And we're pumped to be here with the A-team, Tony and Toby. So, thanks for having us.
Yes.
Absolutely.
So, start us off by describing how the embryo transfer works.
Okay, so like what we saw today, we're basically trying to make one cow have multiple calves instead of a single, and we're doing that by putting her embryos in other cows. So you guys set up recipients, you set up donors. We're able to collect quite a few embryos today thanks to these lovely ladies that found them all, froze them, got them in cows, and we're able to put them into other cows that are of lesser quality so that they could raise higher quality, better genetics for Colby Community College, maybe to sell someday.
So why don't you guys explain a little bit about what your role is today and what all you guys do?
We're embryologists. We are, technicians. We assist the veterinarian. One of us is in the lab doing the microscope work, and then the other is helping shoot side and just kind of being the secondary with setting up filters and rinsing and helping out that way.
Yeah, and so with the microscope, my job is to search through the dishes that we have rinsed the filters into and find the embryos, and then once I find them, I will look at them closely and grade and sort them, and then if they're good enough to either freeze or transfer, I'll move them down, and then we go from there.
It's a team trying to use advanced reproductive technologies to help a producer, and it takes the whole team to get it done. They're finding embryos, determining what we're going to do with them. I'm shoot side, just trying to collect the cow, get the embryos out, and then trying to find ways to put them back in. And it's a great team when it works well. We're all doing our jobs independently and working together to try to pull off a successful day of embryo transfer, and it makes it fun.
Yeah.
Yes.
So are you usually shoot side and are you usually at the microscope?
No, we switch off.
Yeah, we
Okay.
alternate.
We're both fully trained, so
We did rock, paper, scissors.
yeah.
Is there a job that you guys prefer?
I like them both.
Yeah. It depends on if it's cold outside. If it is, then I'd rather be inside with the scope, but
Fair
not.
enough. Yeah.
Both of them are fine.
Weather conditions wise, what do you prefer on a day-to-day?
Man, so I'm a sunny guy. I would prefer spring over fall, just based on the fact that the daylight's longer. We can work later into the day and it not be dark. Temperature-wise, we have to worry a little bit about cold, so that's something that makes it a little bit more challenging when it's cold out. Not here, because you guys have a good lab and a facility that's inside, but that doesn't always exist. So we're pretty spoiled, honestly. People treat us pretty well. We show up, get to do the work, and leave. It's awesome.
So why is temperature such a big deal for embryo transfers?
Just like anything, those cells are really small, and they're in small amount of fluids, so their temperature can change a lot faster than what we would experience. So anytime you're dealing with something in a small amount of fluid, you gotta make sure you're at room temperature, maybe a little bit elevated. If you're at elevated temperature, then you gotta worry about evaporation, and then that affects fluid quality, so lots of things to worry about, but temperature is important. You guys made it nice today. Nice room temperature, indoor heat and air. You guys got a system. You're set up.
So with temperature being a big factor, what else are really big factors when it comes to embryo transfers?
Your donor, how you manage your donors is a big deal. And then on the backside, like today we had the recips, so that you have to have everything set.
Yeah, so embryo quality, recipient quality, those things dictate what our results are going to be that day. they're controlled by environmental factors, lots of things, nutrition, days postpartum, all those things are things that we try to manage ahead of time so that on day 7 today we're successful. And then they're worrying about all the little things that the embryo is worried about. So they're worried about temperature in the lab, sunlight exposure, cleanliness, time. We want to get things done in an efficient process so that they're not exposed to non-cow environment for the least amount of time possible. So they do a great job.
What all do you guys have to keep track of when it comes to all the different processes?
Pretty much anything and everything. So with the embryos, all the donor information, so her full name, her reg number, her breed, when she came into heat, when she was flushed, like all of that. With the sire, same thing, full name, reg number, and then if it was like sex semen or if it was a certain collection code. So all that's going to be on the paperwork. And then once we start looking at the embryos and seeing how many there are, what the grades and stages were, if there was any unfertilized or any degenerates that we determined weren't good enough quality to transfer or freeze. And then the time we flushed them out, the time we put them in, the stimulation protocol that Clay went through. Anything else am I forgetting?
We're doing frozens. We write the
Frozens, we write the cane code. Synchrony, yep. Recips will write down all their tag numbers, which embryo they got, what side the CL was on that Clay called when he palpated them.
IVF conventional.
Yeah, just everything.
IVF embryo or conventional.
Lots of info.
What's amazing is I've been doing it long enough. A lot of this was just recorded on paperwork and filed away. But now as everything gets put into digital systems, now we can sort. Now we can start making decisions and tracking this data and seeing what matters. And so it's like a baseball team, basically, with some crazy stats. And hopefully someday you get time to look at it. Sometimes it feels like you're just always doing it, so you don't really get times to look at it. But there's a lot of data. The producer needs a lot of that information so they can register the calf that is born easily. If they're selling genetics, all of that needs to pass with them, so whoever buys them then knows what they have and what they can do. And the American Embryo Transfer Association and the International Embryo Transfer Association have developed a good system that allows all of this to be readily kept track of and then passed on so that people have access to it and know what to do. It works well.
Yeah.
So with the data, what would you think is the most important piece of information with that data you collect?
Embryo and reset number, right? So that you know when this calf is born what it is probably the most important to you guys. To us, we're looking at stage, grade of embryo, we're looking at synchrony, we're trying to maximize what we do to try to make conception rate as good as possible. And so we like that stage and grade of embryos. We like to know how accurate the heat detection was when they were in heat. Tony was doing a good job of matching up embryos today as good as she could with what was available to try to improve conception rate. And like you look at time intervals from collection to transfer, time intervals from collection to freezing. That is stuff that we're trying to keep at a minimum so that we're not stressing embryos, causing things that could lower results.
And just the cow number, her reg number, making sure you get all that correct on the paperwork or keeping that straight.
So you had mentioned stage and grades of embryos. You want to talk a little bit about that? What the different kinds are?
Tony, you tell us all about stage and grade of embryos.
Well,
You've been doing this since 2020. That's 6 years.
I guess to start off...
That's more than school.
Yeah, maybe. I don't know. I was in there for a while. But ideally, in a 7-day heat to sync with the recip, we would like to do 4s, grade 4s, stage 4, and then embryo quality 1s, 2s. We don't usually go past 2. Sometimes on a fresh transfer, you could kind of go a little deeper on a 3, but normally freezings are just 1s and 2s. And there's also 5, 6, and then if you get into IVF, those are 5s, 6s, and 7s.
So the stage is talking about what? It's talking about size of
the blastocyst.
blastocele cavity, and that's helping us age the embryo.
Yeah.
And then, like you said, that is huge for us to determine which recipients we put them in.
So yeah, stage 4, that's a morula, compact morula. That's going to be typically the youngest that we will see and or transfer and freeze. And then a stage 5, that's your early blastocyst, so it's just when it's starting to form. And then once it becomes more than 50% of inside of that zona, then it becomes a blastocyst, which is a stage 6. And then a stage 7 is going to be your expanded blastocyst. So it gets really big, the zona starts to thin out, the embryo will get a little bit larger in size. And then a stage 8 is when they are hatching, starting to hatch out of that zona. So
You don't
usually,
usually see that in conventional.
no, in conventional you will see up to a 6. But for IVFs we see 7s and the occasional 8
What is an 8?
hatching, starting to hatch. But we don't like to see those because it usually makes, well, it makes the freezing process a little bit more, I guess, difficult for the embryo, since it doesn't have that zona completely covering them. And then when they're a 9, that's when it's completely hatched. And for us, we can't determine whether or not that is the cell mass because there is no zona surrounding it. And we don't want to take that chance in case it is just like a little piece of degeneration or
Plus, they're harder to manage.
hard to manage to, yeah.
They're harder to pick up and move. They're tear easy.
Yeah. So basically, conventional is from 4 to 6, and then IVF is from 5 to 7.
Okay.
That
And
makes
that's
sense.
Yeah.
stage of embryo development.
Yep.
Nice. Good job.
Today we talked a lot about why we do this on day 7. You want to talk a little bit about that? Why
Instead of
why 7?
day 1 or day 5.
Yeah. So it's day 7, it's pretty cut in stone now what we do, but like any industry, it takes a while. Any science, it takes a while to get there. What we do know is we need to wait till they get in the uterus, and we need to collect them before they hatch. And that lines us up somewhere between day 5 and 9. And then over the course of time, the industry landed on day 7, just trying to produce that embryo that is the easiest to grade and probably freezes the best. And we know as they get older, the blastocele cavity grows. They're harder to grade. They don't freeze as well. There's a lot of fluid there that we got to try to get out. We know when we freeze, if there's too much fluid present in the embryo, that's what's detrimental to it after the freezing process. So we try to collect embryos that are, like Toby said, stage 4s and 5s, or morulas and early blasts, and that really lines around day 7 post-heat. And that's why we're here today.
So what's the difference between putting them in fresh and freezing them?
I think freezing, you're taking not your conception rate down, but basically a little bit, right? Just
Yeah.
to go through the freezing process is a little bit harder on them as opposed to just taking them like today and putting them in fresh. Your conception rate is just percentages kind of fluctuate up and down. But we still transfer and freeze at 70% at cross country. So
I think, we try to put in as many fresh as we can. That's a little bit harder on the producer because they have to manage donors. They have to do the donors. They have to have recipients set up at the same time. Some people don't like to do that. So some people are collecting donors and getting them in the freezer and having them frozen just so on transfer day, all they have to do is worry about recipient stuff. We think fresh do 10% better. We have data that shows that, so we're trying to always make as many kevs as we can. So we like to put in fresh when available, and then we finish with frozens, because usually you don't have enough. Today we had more fresh than recips, so that was fun. We got to add to the inventory.
Heck yeah.
So
We were very excited about that.
yeah, good day.
Better than average.
Yeah, that's all you can ask for.
Yeah. So, speaking of better than average, you want to explain kind of what average is and maybe some of the highs that you've seen?
I don't know if anybody likes to talk about the highs because that's, the one that's the goal, but that's not what's always accomplishable. But yeah, conception rate varies from 0 to 100. The more you put in, the closer you get to average. And for all generas of the ET industry, fresh conventional do 70, fresh IVF do 50, 60, frozen conventionals do 50, 60, frozen IVFs do 40. somewhere in there. So there's all kinds of variances based on how we're producing the embryos and what we're doing, whether we're putting them in fresh or freezing them. Average production is somewhere around 6 to 7 embryos per conventional collection, probably about the same number per OPU event. So every time you collect an animal, you're trying to make 7 embryos and you hope they do 60%. So if you can get 4 calves out of every 7 embryos, you're doing good. Not everybody can pull that off, but that's the goal.
How did you guys land on embryology?
Yes.
I was hoping you were going to ask that.
I was waiting for
want to
the
hear
end.
Oh yeah, I was
what
gonna say
Tony
that was my
and
end
Tony
question.
have to say about this. And then I'll answer mine.
I'll go first, I guess. So in college, I was majoring in animal science. I knew I wanted to do something with cattle. I took a couple classes that kind of introduced me to the reproductive technology side. And originally, while I was in college, I was thinking, okay, I want to go in AI. But then my cousin is a client of Clay's, and she was getting a cow flushed, and she called me and she was like, hey, you should come with me and see this process and meet the crew and Clay and Joel. And I was like, okay, yeah, why not? And she's like, you might want to bring a resume too in case you like it. And so I did. It was like I think February, maybe April of 24. So I was only a couple months from graduating from K-State. And I went and I saw the process and I got to meet everyone. And then I gave Sandy my resume. I was like, hey, like if you guys are looking for anyone, like feel free to call me or email me, whatever. And yeah, so that's kind of how I got my job.
That's awesome.
Yeah.
Not gonna age myself, but I got hired as a horse side of doing repro and then into sheep and then into the cattle with Dr. Rock, and I helped her since I don't even know, forever ago. And then on getting to know her and helping with that, I met Sandy and Clay and started doing the scope at cross country and in the bovines. So horses brought me here.
Yeah.
Heck yeah.
So that's how I saw it. Like Toby grew up, you know, in the ag industry, showing some heifers and knew a lot of people that we kind of knew, right? So we were lucky to stumble into Tony. It was awesome to see her, you know, start out with the horse world, and then I knew early on she really was good with cows. She just didn't know that yet. And
She didn't want to know it yet.
She didn't want to know it yet, but she over time like became interested in cows and just started doing more and more of it. And honestly, you know, 5 years growing on 2 years, right? 2 years. I think that's huge for us to, you know, find the right people that are in agriculture, that want to stay in agriculture, that want to be a part of meeting the people that we get to work for and do the work for them. It's just fun for me to see people recognize. Somebody out there, Tony, said they recognized you from somebody's place. So it's just awesome that how small agriculture is and the amazing people that we get to work with. It's just a blessing. That's ultimately why I love this job. I grew up with cows. I knew to survive in the cow world, you had to either feed them or breed them. And to me, repro was more fun than driving a feed truck or doing math. And so I gravitated to this. K-State, you know, there was some people there that made that fun for me. I decided basically go to vet school just so I could try to get to this spot today, which is doing embryo transfer. And ultimately, that's just for the people. It's for the people that we get to work with, and it's for the clients that we get to work for. And it's been a blessing. It's been awesome.
Yeah.
So what would be the most difficult part of your job and your guys' job?
And the most fun.
Yeah, and then what's the most fun?
I think that's changed over time, I bet. But let's hear
Like
this.
high-low buffalo.
For me personally, the most difficult part of my job is sitting at the scope when the chair is not necessarily at the right height. Because you will be at the scope for hours and you're either scrunched over or like really arching your back trying to see through the scope, and it just kills my back sometimes.
Right. Chairs are important.
Chairs are very important. You wouldn't think, but they are.
How were they today?
Today was good. Really good, yes. No complaints.
School chairs.
The high, honestly, I like going out and meeting our clients and seeing how their operations run, and just getting to meet people. I think that's my favorite part.
I guess the low for me is kind of the same with the position of the chute / how high you have to stand or away from assisting, and I definitely second the chair. It's detrimental on the low side. And then the high for me, I love like you find them, you freeze them, you come back, you put them in, and then you get to see your results like the next year or whatever. Like that's just, I think, nice to keep track of.
I figured you'd say splitting them. Splitting
Yeah.
the embryos
Yeah.
would be pretty fun.
Yeah, that is pretty fun too. And then seeing their results as well. Like that's,
Absolutely. That would be really cool to see, come back the next year and keep going through even a producer's place and seeing how well you do over time.
yeah.
I think that to me the low for me is the travel. And why it's like I enjoy travel. I enjoy it. It's like a race. But what I see is that's what is the reason that people don't like this job longer. It's because it's just too much. You can't start a family. You can't have the family that everybody thinks they want and do this job forever. It's hard. So I see that as being somewhat of a low for people. That's why ultimately people like Toby and Tony maybe don't work for us for 10 years. If we could figure out a way to do that better, then I think it would be easier for them to like this job longer. Because I do agree with both of the things they said. That is the awesome part of it. But when you have to drive through 4 or 5 states to stay busy and do the work, then it's harder.
Right.
The best part, just duplicating what they said, is just the days. Like we're out here in Colby, Kansas, collecting Angus cows, and putting in little Angus babies and trying to make more than we did last year and having fun doing it, getting to meet people that are passionate about agriculture and trying to figure out where they want to be.
So, what advice would you give to somebody that wants to go into the same career?
I think it's great. Like the people you work with become mostly family, and just the knowledge you gain on, any aspect of a job is great. So if you're interested and like not sitting around, I guess would be, we don't usually do that, and it's just high pace, and I mean it's a fun job.
Yeah, I was just gonna say, like, get yourself out there, like, make connections with people, and I guess don't be afraid to do the work. If you want that job, go in there and be like, hey, I'm so-and-so. Do you have any openings, or can I, get a tour? Just go out there and, I guess, advocate for yourself.
Yeah.
I think that's huge. I mean, communication, right, is important. And making sure you're talking to people and talking to the people that you want to get to know or want to be a part of. I think that's something that we don't do as well anymore. Send an email or communicate with them, get involved. That's huge for anything, any industry. But it's huge in ag. Ag it's a people person place.
100%.
If you want a job, Toby was a perfect example. She wanted a job, she went and found it and kept bugging.
Yeah.
And
Worked out.
She's
But here she is.
There I am.
been here for 2 years and does an awesome job.
You said travel's a big thing. You guys are based out in Manhattan, Kansas. Is there any other places in Kansas that have clinics?
Yeah, there would be 4 or 5 other clinics, probably maybe 5 or 6 other clinics in Kansas. I would say, depending on the state, there's anywhere between 5 and 25 clinics that just do embryo transfer.
So, how far do you guys have to travel?
Travel is relative. We used to say our radius was 5 hours. It's a little further sometimes. It really just depends on if you want to go work for the people and they want you to go there.
Yeah.
And then you're willing to go do the work. So then you try to make it work. Try to figure out how to get there, how to get back, keep people happy.
Yeah.
But for the most part, we're within 4 or 5 hours. We drive a lot, 5-hour trips. Like Colby from Manhattan, Kansas, you wouldn't think it's a day trip, but it is. Drive out, drive back.
Oh, I know.
Most vet clinics wouldn't approach it that way. They would stay within an hour, 2 hours.
Well, thank you guys
Yes,
so much.
thank
Yeah,
you.
Thanks for having us.
this was a great day. I'm pumped you guys are doing this. Thanks for having us, guys.
Thank you.
Yeah, thank you so much.
Thank you.
Good job, Toby. Good job, Tony.
Well, folks, you heard it here. We'll see you next time.